Assalamualaikum warahmatullahi taala wabarakatuh, and good afternoon to all the audience and participants of this webinar. I am Dr. Muhammad Shafi from International Islamic University Malaysia, will be the moderator for this webinar. On behalf of the College of Ophthalmologists, Academy of Medicine, I welcome all the participants to this webinar. The topic for today's webinar is on eye disease in children. As we all know, the World Sight Day 2021 was celebrated globally on the 24th October with the theme of Love Your Eyes. Thus, the college has arranged series of webinars in highlighting the important issue related to the eye health. As for today, this is the last series of the webinar, and we will be focusing on the eye disease in children. To begin our webinar today, I would like to invite upon Associate Professor Dr. Jemimah binti Cik Hamzah, the Vice President, College of Ophthalmologists, Academy of Medicine, to deliver her welcoming remark.
Assalamualaikum and happy World Sight Day. Hi, I am Associate Professor Dr. Jemimah Cik Hamzah, the Vice President of the College of Ophthalmology, Academy of Medicine, Malaysia. World Sight Day is celebrated on Thursday of the second week of October every year. This year, the theme for World Sight Day is Love Your Eyes. To celebrate the World Sight Day, the College of Ophthalmologists, Academy of Medicine Malaysia has organized a series of webinars targeted to the public and community to give information on eye diseases and eye care to ensure better care for the eyes. Eyes is one of the most important but often forgotten senses in the body, which need better attention. Eyes should be taken care by every person in the society, and it starts with our own self. Infants and children especially cannot take care of themselves. Therefore, their parents need to ensure the eyes of their children are in good condition. Failure of eye stimulation during childhood can cause vision to be poor and not able to function properly. In the other hand, when growing older, various diseases related to eyes may occur, and regular checkups on the eyes are necessary to ensure the eyes are in perfect condition, as eye diseases or problems cannot be seen with the naked eye. Eye problems can happen to anyone, either silently without any symptoms, or symptoms such as loss of vision, red eye, pain, or swelling. Our webinar series will last for 1 month, and each week will feature different topics by experts who will give tips and ways to ensure vision can be maintained. There will be also case sharing on various scenarios involving eye injuries, eye diseases related to systemic disease, aging that can cause permanent blindness if we are nonchalant about our eye care. I hope this webinar sessions will benefit all. Please feel free to ask our expert on any issue related to the topic discussed. Hope you will enjoy the webinars as we enjoy preparing them for you. Love your eyes. Thank you.
Thank you, Associate Professor Dr. Jemimah binti Cik Hamzah, for the welcoming speech. Without further ado, I welcome Associate Professor Dr. Nurliza binti Khialdin to deliver her presentation. Associate Professor Dr. Nurliza binti Khialdin is currently a consultant ophthalmologist in Universiti Malaya. She had underwent expert training in pediatric ophthalmology in the Royal Children's Hospital, Melbourne in Australia. To Associate Professor Dr. Nurliza binti Khialdin, the floor is yours.
Thank you, Dr. Shafi. Assalamualaikum and good afternoon. I will be talking on eye diseases that is important for parents to be aware of. Before we go further, let's look on how vision developed. We are all born with poor vision, and the furthest that an infant can see is the mother's face. That is why when babies breastfeed, their vision will be fixated on the mother's face, and this creates a bond between mother and child. As you can see in this table, vision developed gradually over the years, with the fastest development occurring in the first year. After that, vision continues to develop until about 6 to 7 years. Now, as this chart shows us, besides vision, there are other visual functions that needs to develop. The brain and the eyes have to learn to work together to achieve what is called binocular single vision, or what we know as 3D vision, in which perception of depth develops. Now, this usually occurs, the integration of eye movement, or what we call fusion, occurs in the first year, occurs fastest in the first year of life, but it continues to develop as the child grows until about 7 to 8 years old. Now, a squint is sometimes seen when the child is less than 6 months old, but after 6 months old, a squint should not occur, because by this time a certain amount of binocular single vision has developed. Now, this is a very important complex function that may not occur in some children, especially those who are not well in their early childhood, or this function may decompensate for whatever reason as the child is growing up. Now, if a child fails to develop this function, then a squint will develop. A squint occurs when the two eyes are not aligned. Now, if you suspect that your child has a squint, how do you detect it? You have to ensure that you observe your child from the front, not from the side. So face your child, make sure that you can see both your child's ear, which indicates that you are directly in front of your child. Observe if both eyes are aligned. You can play with your child by shining a torchlight. As you can see in this case, the first picture shows that the left eye is actually fixating on your face, and you can see that the light from the torchlight is reflected from the center of the eye, whereas for the right eye, the eye is deviated outwards, and you can see that the light falls not in the center of the cornea, but at the side. Now, for the second picture, you can see that the right eye is actually looking at you, and you can see that the cornea reflex is central, and the left eye is squinted inwards. So these are the two types of squint in which the deviation occurs outward and inwards. It can also deviate upwards and downwards, depending on which muscle are affected. Now, what are the causes of squint? It's basically because of muscle imbalance for whatever reason. It can be present at birth, so we call it as congenital squint, or it may develop later in life, or it may be due to various causes that causes poor vision in the child, and therefore a squint develop. So it's very important that if you suspect that your child has a squint, that you need to consult the ophthalmologist so that we can exclude other causes that may cause poor vision resulting in a squint. Now, what are the treatment for squint? It depends on the cause. If it is just a straightforward squint because of muscle imbalance, we have the options of wearing glasses if there is presence of refractive errors, or if the vision in the squinted eye is poor, then you can start patching. What do we do? We actually patch the better seeing eye and force the squinted eye to see. So it's like what we call as lazy eye. So we force the lazy eyes to see so that the eye will develop vision. And lastly, if we have no other option, then we would advise for surgery. So in this child, you can see that the left eye has outward deviation. We did muscle surgery on both sides of the eye. On the outer side, you can see that this is slightly red, and with glasses, he is straight. Let's look at another condition called leukocoria or white pupil. As you can see in this picture, our pupil is black in color. However, if there are medial opacities, the pupillary reflex will be white in color as seen in the left eye. Now, if you look at the cross section of this eye, the media of the eye are all clear, so the image that passes through the eye will fall onto the retina unobstructed. However, if there are opacities in any of these media, then leukocoria may develop. What are the causes of leukocoria? If you look at this picture, cataract or opacity of the lens may cause leukocoria. Retinoblastoma or cancer inside the eye on the retina may cause leukocoria. Infection in the back of the eye and also bleeding in the eye may cause leukocoria. Now, it's very important that we notice the presence or absence of leukocoria in our child because it has a significant implication on the development of vision of our child. Let's look at allergy in the eye. This is actually quite a common condition in which the child will rub the eye because of eye itchiness. And usually after a bout of excessive rubbing of the eye will turn red and they may be discharged from the eye. But this is different from infective conjunctivitis. It may occur in children who has history of allergy. That means the child has eczema or allergic rhinitis or asthma. But it can also occur in children with no history of allergy. The treatment is actually quite simple. Usually most children would do very well with a single eye drop, but in severe cases, they may need multiple eye drops. It is very important that parents notice this condition because excessive rubbing of the eye can cause a refractive error known as astigmatism, and they may need to use glasses to correct this refractive error. So it is best that if your child rubs the eye, consult an ophthalmologist, have a look at, so that we can have a look at the eye, and if there is an element of allergy, then it's best that the child is started on eye drops. Now, there's a lot of eye drops that is available in the pharmacy, but most importantly, parents have to know that they have to avoid steroid eye drops in allergic conjunctivitis. Because steroid has a side effect of increasing the intraocular pressure and causing glaucoma. We have cases in which parents or the child themselves, as they grow older, bought steroid eye drops from the pharmacy and use it continuously for many weeks or many years. And by the time they come back and see us, because of poor vision, we notice that they have advanced glaucoma. So even though it's a simple case of allergic conjunctivitis, if it is not treated properly, it can lead to other problems. I would like to share this condition known as shaken baby syndrome because we have been seeing an increasing number over the years. In fact, we saw a spate of cases after the MCO because parents started working and they leave their children or babies with a caretaker. It happens when there is a vigorous forward and backward shaking of the child, as is shown in this picture. So what happens is that the brain of a child, especially those less than 1 year old, is smaller compared to the size of the skull, and there are veins that runs from the brain to the structure that is adherent, and therefore when shaking occurs, these blood vessels are torn, causing bleeding into the brain. This is a very important condition because it is life-threatening and it is also sight-threatening. Similar to the brain, what happens in the eye is that there will be bleeding. As you can see here, those red spots are bleeding in the eye, and it can range from being mild to very severe. So this is a picture that shows severe bleeding in the eye, and it will have a significant impact on the vision of the child. Even after the bleeding has resolved, the vision will be affected. As parents, what can we do to ensure that our child's vision is developing normally? One is to observe the alignment, as I mentioned just now. How do we detect a squint? Second is to observe the size, the shape, and the color of the eye. compare the right and the left eye, and also compare with other children. If there is any abnormality or anything that appears to be different, then you should bring your child to see the ophthalmologist. And another important thing is to play peekaboo with your child. That means as a child is playing, you try and cover one eye and see if the child can continue playing, and then you cover the other eye and see if the child will continue playing. It's important that we ensure that both eyes' vision develop normally, because sometimes what happens is that the parents or the child themselves do not notice that one eye has poorer vision compared to the other for whatever reason, and they will only notice this when they go to school at about 7 years old, when there will be a vision screening done. So what you can do is, at home when the child is playing, just close one eye and close the other eye and ask the child to see something that is far, and make sure that the vision is the same in both eyes. Thank you for tuning in. I would be happy to take questions either after this session or at the end of the session. Thank you very much.
Thank you very much, Associate Professor Dr. Nurliza binti Khaliddin, for a very informative topic and sharing. Next, I welcome Dr. Safinaz Muhammad Khialdin to deliver her speech. Dr. Safinaz Muhammad Khialdin is currently a consultant ophthalmologist in Hospital Chancellor Tunku Mukhlis, Universiti Kebangsaan Malaysia UKM, and she had her specialization in pediatric ophthalmology. Her research interest is in the management of myopia, amblyopia, and refractive error. To Dr. Safinaz, the floor is yours.
Assalamualaikum and good afternoon to all. My talk for today is on myopia and refractive error in children. So, what is refractive error? It is actually a common vision problem. It happens when the light entering the eye is not focused correctly on the retina, which is the light sensitive layer of the eye. This happens because of the irregular or abnormal shape of the eye. So, a person with refractive error does not see objects clearly. There are many types of refractive error, and the most common one is myopia or nearsightedness. Others include hyperopia or farsightedness and also astigmatism. In myopia or nearsightedness, the eyeball is longer than the normal eye, and the object seen at distance is not clear. While in hyperopia, the eyeball is too short and the object at near is not clear. While in astigmatism, the front part of the eye, either the cornea or the lens, is not even or not regular, and there will be multiple points of focus on the retina, and in this condition, the image form is also not clear. Here, I want to bring your attention to a type of refractive error, which is myopia or nearsightedness, which is the most worrying type of refractive error because it can cause severe visual impairment and even blindness. Let's look into the global prevalence of myopia. This was predicted by the Brian Holden Vision Institute, and they predicted by the year 2050, like 50% of the global population would be affected by myopia. Well, the prevalence of myopia in Malaysia is also quite alarming. If you look into the children aged 7 to 12 years old, there has been an increment of prevalence from 10% in 2003 to 26% in 2019. Whereas in the secondary school children aged 14 to 15 years, there was an increment of 34% in 2005 to 60% in 2018. And what is more alarming, that we found that there were 24% new and untreated cases among these children. So looking into the upgoing trend of myopia prevalence, so what actually are the risk factors contributing to the onset and the progression of myopia? Well, the first one is actually genetics. And then the second risk factors is environment or our lifestyle, which include less outdoor activity and increase in intense near work, which include reading, writing, and in the current pandemic is more of online learning and also the use of gadgets, which also increase the intense near work activities. When looking into the genetics as the risk factors, if one parent has myopia, then the child is two times more at risk. And if both parents are myopic, then the child is 8 times more at risk. And it also depends on the severity of the myopia of the parents, then the child is also more at risk. Looking into the outdoor activities, actually, the sunlight helps in controlling the eyeball growth or the eyeball elongation because the sunlight stimulates dopamine in the eye and it prevents the eyeball from growing too long. So, when there is lack of outdoor activities, the eyeball grows longer and causes myopia. The next risk factor is actually intense near work. Near work would include reading, writing, and gadget use, of course. The continuous near work of more than 30 minutes is the one that causes myopia, and also the distance of less than 30 centimeters also poses the risk of myopia. And as I mentioned earlier, we are currently facing this COVID-19 pandemic, and this pandemic has worsened the pandemic of myopia because it has intensified the myopia risk factors. As we know, all of us are confined indoors, including children, so they lack the outdoor activities, thus, they are not exposed to the sunlight. And also, most of them are doing online classes, and there is also increase in gadget use. And this also contribute to the increase of near work activities, and this also intensify the myopia risk factors. So, when do you suspect that a child has refractive error? One of the symptoms is when a child likes to squint the eye. Squinting the eye is making the eyes smaller because when they do this, actually the image that they see do become a bit clearer. They may also complain of eye strain or eye discomfort. They may have headache, frequent headaches. They may perform poorly at school. And of course, if there is a strong family history of refractive error, you do need to suspect that your child may also have refractive error. And also another condition is called strabismus, where the eye might be deviated out or deviated in. We can also look into the symptoms of refractive error according to the types. If we look into myopia or nearsightedness, because the distant objects are not sharp, the children like to hold their books or gadgets very close to the eyes. And in hyperopia, because all the nearby objects are not clear, they may complain of eye strain or eye discomfort after doing close work such as reading, writing, and online classes. And in astigmatism, the vision is blurred for both near and distance, and they may face difficulty with night vision. So when do we screen for the diagnosis of refractive error? Okay, very important that if they have any sign or symptoms of refractive error, as I have mentioned earlier, you need to screen them. But for any children who does not have any sign and symptoms, we really recommend them to have a vision screening as well. This is before they start the preschool, so at about age of 4, and also before they start standard 1. This can be done by the optometrist and also by the eye specialist. And when during the screening, what we do is we check the level of vision. Do not worry if your child still unable to recognize letters or alphabets, because in children we use pictures, cards to check their vision. And if we found that the vision is reduced, then we will proceed to check for refractive error in the child. It is also very important to take note that in children, if we use the automated refractive machine that we sometimes see in the optical shops, it do not give very accurate reading, especially in children under the age of 10. This machine can be used for screening only, but if you want to prescribe or give accurate glasses power, we need to put a special eye drops, or what we call a cycloplegia. This is to relax the muscle of the eyes to get the accurate power of the refractive error, and this is done by the optometrist or by the eye specialist. So how do we treat refractive error in children? Is by giving them spectacles or glasses. And again, I would really want to emphasize that the glasses power must be accurate and do not delay the treatment of refractive error in children. This is very important to prevent amblyopia, or what we also call as lazy eye. So what is amblyopia or lazy eye? When we say lazy eye, it's not lazy to move, but the eye is lazy to see. So these children would have poor vision despite them getting the treatment for the eye condition, such as in refractive error, the glasses that they are given. So the cause of amblyopia is delay in the detection and also the treatment of the refractive error. So why do amblyopia occur? Is because children are still in their vision maturation phase until the age of around 8 to 9. So any long-standing poor vision, such as refractive error, will affect the vision processing center in the brain during this vision maturation phase. So how do we treat amblyopia? Is by doing patching. We patch the better seeing eye. So when we do this, we force the brain to process the image coming from the worst eye, and with time, the image will become clearer and clearer. It is very, very important to take note that amblyopia is irreversible and very difficult to treat after the age of 8 or 9. Thus, it's very important to treat and do not delay the treatment of the refractive error so that the amblyopia, if it has happened, can be treated. So apart from amblyopia as one of the complications of untreated refractive error, we also have other complications. This is especially in myopia or nearsightedness when their power is very high, more than 500. One of the complications is retinal break or detachment. So the retina is the light sensitive layer in the eye. So when you have retinal break or retinal detachment, the vision is really severely affected. The next complication is macular degeneration. So the macula is the center part of the retina. So you can see, comparing the two photos from the normal macula with the one affected by myopia, you can see there is macular degeneration. And in this condition, it can even cause blindness. Apart from that, a child with myopia is more at risk to get these eye diseases when they reach adulthood. Number one is cataract, which is the cloudiness of the lens. And also they are at risk to get glaucoma, which is the disease of the nerve of the eye due to high pressure in the eye. So because of all these very sight-threatening and complications, which can even cause blindness, we need to emphasize that there is treatment to control the myopia, both the onset and also the progression. So the first option to control myopia progression is actually using medication eye drops, which is low dose atropine, 0.01%. And this is prescribed only by the eye specialist, and it cannot be bought over the counter. It must be monitored closely by the eye specialist. So these eye drops helps to control the eyeball elongation, thus it controls the myopia progression. The next option of myopia control progression is actually using special spectacle lenses. So in these spectacle lenses, there are different focusing power on different parts of the lenses. So the center part has different focus, and the peripheral part has different focusing power. And this type of special spectacle lenses can help to control the progression of myopia. The other option is special contact lenses, or what we call as orthokeratology. Orthokeratology was initially used to treat myopia because it reshapes the shape of the cornea when it is used overnight. But over the years, after research, it also shows that it can control the progression of myopia apart from treating myopia. But because autokeratology is a contact lens, so children using this are at risk of getting eye infection. So it is very, very important to properly select the patient. Parents must be very dedicated to take care of the hygiene of the contact lens using proper technique, proper fitting, and they must not miss their follow-up. They must be aware of the sign and symptoms of eye infection and must get immediate attention when that happens. Okay, the next option of controlling myopia is by lifestyle modification of the environment. As we know, outdoor activity is one of the risk factors for myopia, so we need to increase the outdoor activities in children. Research has shown that 2 hours a day of outdoor activity is protective against myopia, as I mentioned earlier, because the sunlight, it stimulates the dopamine from the retina, which controls the eyeball from growing longer. Thus, it controls the myopia in children. So the next option of controlling myopia is near work. So you modify the near work in children. So how do you do that? You can incorporate the 20-20 rule, which is actually after 20 minutes of near work, which includes reading, writing, gadget use, computer screen. You take a break of 20 seconds by looking at something far away, about 20 feet. You must also ensure that the also adopt a healthy reading distance, which is 30 centimeter or more for reading, and about 1 arm length for computer screen. With that, my take-home message for today is I really recommend that all children must have vision screening before they start preschool and also before they go to standard 1. If your child has any sign of symptoms of refractive error, do bring them immediately for an eye check to confirm whether they have refractive error, and do not delay the treatment of getting them glasses or spectacles. And I do really encourage parents, educators, and the public to take part actively in your child's myopia control. So how do you do that? It's actually, you can actively participate with outdoor activity with your children about 2 hours a day. Incorporate the 20-20 rule, that is, I repeat again, is after 20 minutes of near work, take a break of 20 seconds by looking somewhere at a distance of 20 feet. Ensure that your child adopt a healthy reading distance, and very importantly is to limit the use of gadgets, because not only gadgets increase the risk factor of myopia, it can also cause harm in your child's health in other ways as well. With that, I thank you, and let us enjoy the abundance of sunlight that we have in our country, which is also very important in controlling your child's myopia and overall eye health.
Thank you very much, Dr. Safinaz Muhammad Khialdin, for such an interesting topic and sharing on myopia and refractive error in children. As for the next session, I would like to invite our respective guest speakers to open the video webcam for the question and answer session. In this question and answer session, if any participant have any question to the speakers, kindly type it in the Q&A box. Thank you very much. Now it's the time for the question and answer session. If any of the audience have any question, kindly please type it in the Q&A box. But for now, I notice there is no question yet. If you have any question, you can type it. To begin with, I have a question to Dr. Safinaz. This is regarding the myopin or the atropine treatment in the patient with myopia. Is there any specific time or any age group that we should start with this atropine, or any cut line or any I mean the degree of the myopia that we should start on this myopin treatment, Dr. Safinaz?
Okay, thank you for the question, Dr. Shafi. So for low dose atropine of 0.01%, we prescribe this for those we call as fast progressors. So what we do is we look into how fast they progress within 6 months or within a year. For me personally, what I practice is they progress more than 1 - 1 diopter, or what we call as 100. That's the power classes. Then I may start them on the low dose atropine. And I would start as young as 5 years old, not younger than that. And I would continue to monitor whether they progress or not with this low dose atropine. I may increase the frequency from once a day to twice a day if necessary, if they still progress. And we can also offer other option of myopia control, such as the special glasses if they still progress. Yeah.
Okay, thank you, Dr. Safinaz, for the answer. Now I have one question in the chat box, in the question and answer box. The question, if we detect abnormality in baby, when is suitable time to refer? I think this question to Prof.
Thank you for the
Nurliza.
question. Actually, if you notice abnormality in a child, especially in a baby, you should go to see the doctor immediately. You can see see the ophthalmologist straight away because sometimes when you see GP, it may be missed because the eye is very small. So bring your child to see the ophthalmologist and have a full checkup.
Okay, thank you very much. Another question from me. To Prof. Nurliza. I have a question regarding the use of steroid in the patient with allergic conjunctivitis. Is there any specific duration for you to start with the steroid, such as only for 2 weeks or something like that?
We usually don't start steroids in allergic conjunctivitis unless it cannot be controlled well with antihistamine. So usually we start off with antihistamine first. But in some cases, when the allergy is quite serious and severe and does not respond well to antihistamine, we do give steroids. And what we usually do high dose but short term, and then continue with antihistamine. Once the disease is controlled, we stop the steroids and we continue with antihistamine. How long do we continue for? It depends. We know that steroid responder, usually the intraocular pressure will increase after about 2 weeks of continuous use of steroids. Even then, it depends on the concentration of the steroids. There are steroids which is of low concentration and high concentration. The higher concentration, of course, will induce glaucoma faster compared to the lower concentration, which may not induce glaucoma even if used long term. The problem with allergy is that it is a condition that lasts for many, many years. And parents, and including the patient themselves, they know which drops works very well. And steroid drops are just like miracle drops. You put it inside the eye and you feel almost immediate relief from allergy. So many of these patients, they don't go to the doctor because they know that, oh, this eye drop works. So they buy it over the counter in the pharmacy and they use it for many, many weeks. Some use it for months. And we have many, I wouldn't say that it's rare. Yeah? You do see from time to time university students come in with very poor vision in one eye, and then you see that they have advanced glaucoma because of prolonged steroid use. So I think, if anything from this session, a take-home message, very important, that if your child has allergic conjunctivitis, don't buy over-the-counter medicine, especially if you know that it is steroids. It has a very severe implication to the eye in long term. Antihistamine is like a choo-choo train. It works slowly, but it will take you to your destination eventually.
Thank you very much for the answer, Prof. Nurliza. Another question in the Q&A box. Is it possible to have combined myopia control management, either atropine with myopia control spectacles lens, or autokeratology with atropine? I think this question to Dr. Safinaz.
Yes, I think I did mention a little bit just now. Yes, there is a combination of treatment for myopia control. We can combine the low dose atropine 0.01% with either autokeratology or with the other special lenses such as the progressive lenses or the other multifocal lenses. But usually for the atropine, the eye specialist would prescribe. But for me, myself, when I think the child would need additional treatment with the autokeratology or the special lenses, I would refer them to my optometric colleagues. So we do a combined management with them. Yeah.
Okay, thank you. Another question from Ainatun Nadrah Makhtar. If we detect myopia in school kid, at what range age we need to refer to ophthalmologist? And at what age we just need optometrist assessment only?
All right. Okay. The age range which needs an eye specialist or a hospital assessment is if they are less than 10 years old, 9 years or below. The reason why is because if you just do a simple refraction check in the optical or optometrist shop, you don't get the accurate power because you need the special eye drops, which is the cycloplegia, which really relax your muscle. Thus you get the accurate power. If you don't do this, then your power won't be not correct. So if it is less than 9, we do really recommend that the child gets a visit to the hospital to get accurate power. But if there are around 10 or 11 or 12, then I guess a refractive test in the optometry shop would be all right. But less than that, they need to come to the hospital.
Thank you very much for the answer, Dr. Safinaz. Is there any other question from the audience? Okay, as for now, I think there is no other question. I think if there is no other question, I will finish the session here. Okay, thank you very much again to the honorable panelists, Associate Professor Dr. Nurliza and Dr. Safinaz for answering the questions and sharing their expert knowledge with us. We hope this session on the eye disease in children benefits all the audience. And special thanks also to Bayer Pharmaceutical in helping us to organize this webinar. For the previous series of webinar, you can see the recorded videos at College of Ophthalmologists, Academy of Medicine of Malaysia, Facebook and YouTube. With that, thank you and enjoy your weekend.
Thank you.
Thank you.